Well, hello, Newfoundland and Labrador, and welcome to another episode of TalkNL. My name is Rudy Norman. As you may or may not know, I'm not sure. If you've tuned in before, you probably do. If this is your first time, then welcome. So this is a podcast that we do live every Wednesday night at this time, and we talk about everything Newfoundland and Labrador and all the issues that are facing the province right now. And of course, I am joined once again by my trusty sidekick. I don't know if I got to come up with a better title. Trusty sidekick. It seems like it's been overused, Graydon.
No, that's
But
all right, bro. Like I've been
that's
called a
good.
lot worse, so
You're good with trusty sidekick, are you?
oh yeah, absolutely.
How's it going today, Mr. Graydon Pelley? How's it going?
Doing good, Rudy. Just enjoying the nice early spring weather, and
Beautiful.
got pretty well most of my preparation for planting season done, and growing
Yeah.
season, and looks like it's going to be a good year.
So one of the things, Graydon, that that came out of the pandemic, I guess last year, was you decided to get into a little bit of gardening, hey?
Oh yeah, we built a greenhouse, and we got a bunch
Yeah,
of raised beds out in the backyard, and growing vegetables and nice strawberry patch and all kinds of things
yeah,
growing. It's a lot of fun, and it's very rewarding.
yeah. This wasn't one of our topics on the list, but now that it reminds me, I saw that the government just announced some land use for uh, potatoes. Looks like
Yes, yeah.
we're trying to become the next PEI, I guess.
And it's really close to my home here,
Yeah, there you go.
just
So
outside of Deer Lake Junction Brook.
who knows? Who knows? You might get a consulting job or something with them.
Well, I'm not going to sit by the phone for that, but I don't know if there's any funds available for fellows starting up a little greenhouse and backyard gardening or not. But with the price of with the if you want to do any expansions, Rudy, with the price of lumber and all that, you might have to go to government for some programming or something.
Yeah, and you know what? A friend of mine, I saw today. I believe it was 15 pieces of 2x4.
I saw that.
Was $185. It worked at
$12, and I think it was
60 cents.
$12.30 or something for one piece of 2x4x8.
12.60.
Yeah.
Well, 12.60 a piece. It was, so whatever that ends up being, right?
Yeah.
So it's getting a bit ludicrous, to be honest with you, Graydon. I mean, we're feeling the pinch of it here now. When it comes to like building materials and groceries, and the price of everything is just skyrocketing. And I mean, it's one of the downsides, I guess, of a booming economy.
And Rudy, I'd like to see some people tonight talk about that and the difference they find. I know I find a big difference when you go to the grocery store and pick up 2 or 3 bags of, the regular shopping bags now that you get at the store, the recyclable,
Yeah,
the reusable bag. And the difference in what it costs for 2 or 3 bags of groceries now as opposed to a year ago, it is just astronomical. It's outrageous.
It's crazy. And I saw some statistics today. I mean, we look at it now, Graydon. I think the TSX has grown something like 30% in the last year. The dollar now is at 81 cents or something compared to the US dollar. So I mean, we're seeing numbers now like back in 2008 when we had the economic crisis. We're seeing numbers like in those levels now. So one has to hope that it doesn't get too bad, because I mean, obviously inflation is a big concern, and I mean, it can only you can only bend so far here, right?
But Rudy, and the thing about it is, the bad thing about it is, I mean, we know that the pandemic has caused problems with supply and all of that stuff, but I still think, talking to some business people around and talking about their suppliers and stuff like that, I still think there is a certain level of gouging happening now. And of course, us consumers, people that are buying these things, are certainly suffering and finding the pinch of that. And I mean, people in Newfoundland and Labrador, many people that have lost jobs, that have, their hours of work have been diminished down quite a bit, and they're finding it pretty tough. It's pretty strenuous.
Yeah, and I mean, even the people, Graydon, that are on fixed incomes. I mean, I think about senior citizens. I think about people who are retired, who just are not going to be able to keep up with it because, when they plan for their retirement. I mean, maybe they've been retired now for a few years. You take someone that maybe retired at 60 and now they're 70. So, I mean, they felt like they had their life planned out. They had the next, however many years planned out. So, I mean, they're living on a fixed income. They're living within their means. They sat down and said, well, you know what, this should be about how much we're making or what we need to make and so on and so forth. And I mean, now just to be hit with this, I mean, I know who can predict a global pandemic. Nobody can even come close to saying, well, what happens if there's a global pandemic? But at the same time, because of that, you can't fault them for not preparing for this either.
No, and I think about people who were going to retire this year or in the next year or so, and because of things that have happened, because of, like you said, it could be a break in their employment and whatever, but they've got to make some major adjustments in their lives, and it takes a long-term effect.
Yeah, exactly. And I mean, there's so many like that. There's so many people who are. I saw OAS just got a little bit of a raise. I think it was $3, a $3 raise. So I mean, if these public service, if these pensions and stuff, aren't keeping up with inflation, then if it's not indexed to inflation, then people are going to be suffering over the next little while. Because I personally think that it's going to get. I'm not an economist or anything by any means, Graydon. I'm far from it, but I just feel that it's going to get worse before it gets better for sure.
Well, it has to, with all of the spending that has happened on all levels of government to try and get people through this pandemic is certainly going to. I mean, you think about the long-term payback of all of this spending, it's going to take place, and but we are where we are, and we've got to certainly play the card that we're dealt.
We're definitely, we're all in this together, so to speak. Speaking of all in this together now, Graydon, I mean, a lot's happened, of course, in the last week, like it always has. And I mean, I like to kind of recap a little bit and see where things are. One of the big stories this week, of course, and if you followed the news or if you're on Twitter or anything, one of the big stories, of course, has been the fact that we, as a province, we've sent 9 healthcare workers to our friends in Ontario, and they left yesterday, I believe, and they went to Ontario. Maybe you've got the numbers there, Graydon, on the breakdown of. Do you have that? How many?
I don't have the numbers, but let me see. I
believe
I know there were there 5 doctors or 3 doctors? I'm not sure of the exact breakdown, but there were 9.
So there were some doctors, a number of doctors, a nurse practitioner, and then the rest were nurses, right?
Yeah.
So, Graydon, what do you think of it? How are you feeling, about the fact that we did send these healthcare workers to Ontario to help out in their COVID crisis up there?
Well, now, Rudy, there's a whole lot of different levels you can look at this. But first of all, I will say sincerely, I throw out a bouquet to the people that raised their hand and said that I will go, because let's face it, they're leaving their families, they're leaving the place of Newfoundland and Labrador that's been doing quite well with the COVID numbers and controlling it. And they've put up their hand and said that we will go and try and help. And they're going into a hot spot. They're going into a place where we know what has happened in Ontario over the last number of days and weeks. And it's certainly a challenging time for them. So listen, I think these healthcare workers that volunteered to go should get a bouquet sent to them and say, look, thank you for representing Newfoundland and Labrador and how we want to help our neighbors. We know it's a big decision to do that, but hats off to them for doing that. And I know I've read the news articles and I've watched social media and listened to people talking. There's a whole gamut of different perspectives on this. We heard about the people in Labrador talking about the shortage of doctors and nurses on the Labrador, healthcare workers down there. And they come from the perspective that we should be helping our own before we reach out. And you're going to get all kinds of perspectives. But then again, there's people in Ontario talking about it as well, Rudy.
Yeah, and I mean, well, let's talk about here first. Let's go to Newfoundland, and I found this interesting, Graydon. This person here on Twitter, Jeremy Rumble, right? And I mean, there's been both sides of this. I've seen immense praise for this move. I've also seen a lot of criticism, and it feels like that, you know, there's been a bit of war of words here in the last few days. I think that's fair to say. If you've been watching the comment section and the Twitter conversation and whatnot, but people have been, you know, people obviously have strong feelings on both sides, and Jeremy Rumble is one of them. And so he says sending a plane load of rural Newfoundlanders to Ontario so they can find a family doctor. Sorry if this offends you, but my family is tired of having to phone the hospital and hoping to luck into booking the same doctor for prescription appointments and the like. If you can't begin to understand why some in Newfoundland and Labrador aren't happy with sending healthcare providers to another province, you just might be a townie. So obviously,
but Rudy, with all due respect to this person's concern, none of these people who are going or are gone are family doctors.
I'd have to confirm that, to be honest.
I don't think so. I heard that being discussed today, but I'm not sure. But I don't think sending these people going to Ontario, not sending them, that's the wrong term to use, but these people volunteering to go to Ontario to help out, I don't think that's going to make a difference whether or not a person can get a family doctor in Newfoundland or Labrador.
No, maybe not.
But I understand the principle of what they're saying.
Right. I think the argument for a lot of people, Graydon, is that it's the semantics of it. Yes. I think the fact that, you know, while we have our own challenges here that aren't being addressed. Okay. I think a lot of people, especially those in rural Newfoundland and Labrador, they are struggling, and I can speak to this firsthand, Graydon, to be honest with you. My family has had, even today, my family has had experiences in getting so much as something as a prescription refill, which normally is a very trivial, it's a very a menial task, right? I mean, getting a prescription refill, if you've been on a medication, maybe you have high blood pressure or whatever, whatever ailment you have, and you're taking this medication and you need this medication, and all of a sudden you need a prescription refill. Not having not just a family doctor, but not having access to any doctor, is frustrating. I know people personally, like I said, people even in my own family, yesterday, in fact, who had an appointment at the local clinic to have a phone appointment for a prescription refill, got a call saying the appointment was canceled because the doctor wasn't available, right? And there's only one doctor available. So we've got people now, Graydon, that are going as far as Gander and Grand Falls, Windsor and Corner Brook, and they're going to these places to find a family doctor willing to give them a prescription refill over the phone, right? So I mean, I can understand the frustrations that a lot of people are experiencing when the access to healthcare is very sporadic at best.
Mhm.
right?
And probably, I mean, you're talking about these people traveling to these places, and I mean, you're facing the same situation in Deer Lake, Corner Brook, these areas. People can't find family doctors right across Newfoundland and Labrador. But I think the issue is deeper than that. I think the issue now needs to look at is what can the healthcare system do, or what can our health authorities do to and our government officials do to, for a person, for example, like you mentioned, who's been on a medication for X number of years, it's something they have to get refilled periodically. Why do I know that you got to go to a doctor and get a checkup every now and then, but for the fact of filling a prescription that they it's a regular routine thing, why do they need an appointment with a doctor? Why can't the pharmacist that's been looking after them for X number of years say, yeah, this is an ongoing refill. Why can't we just fill it?
Well, pharmacies have been given some leeway in that, and again, just as I'm not an economist, I don't proclaim to be a doctor either. I mean, pharmacies can basically give temporary prescription refills. So, if you've got a prescription, and say you go and you get 3 months at a time, or 6 months at a time, or
Yeah,
whatever. So if you've run out, and for instance, the doctor has not, you can't get an appointment until 2 weeks time. Well, the pharmacy can give you 2 weeks prescription, or 2 weeks medication, or whatever it is. The problem with this, Graydon, is that this is not just a temporary thing where, I'll get my temporary 2 weeks and I'll see the doctor in 2 weeks, because what's happening is that in 2 weeks time, your appointment is getting canceled as well. And it's just such an overbearing weight on the system. It feels like now, that it's becoming a point where it's reaching a critical mass. And I realize it's not just Newfoundland and Labrador, because
mm-hmm.
going back to this, I mean, this exact thread that we were just looking at with Jeremy here. This David says under it. He says here, haven't had a family doctor in town in a decade. Couldn't find one in Corner Brook the year I was there either. Headline suggests this is common across Canada. How does bringing up insipid false narratives to further divide and probably help the situation? So, I mean, David's obviously critical with Jeremy's point of view. Robert says there's data on this. David, look at the report. Reports are known form of insipid false, So
Yeah.
Jeremy's being sarcastic there. So anyways, the point is, I realize it is an important issue for all across Newfoundland and Labrador,
Absolutely.
and the Newfoundland and Labrador Medical Association has raised this issue. They've said that right now they're in a critical place.
Yeah.
My question, Graydon, and this is 100% my question, is what in the world is the Premier and the Health Minister doing about this? Because it feels like, and this is where my criticism comes, it feels like that the Premier is all for doing a photo op, sitting at his desk, supposedly or allegedly talking to Rob Ford while he has his text messages up on the screen. But anyways, he says he was talking to Rob Ford. Is it Rob Ford? Doug Ford, sorry.
Doug Ford.
Rob Ford was his brother who
Yeah,
passed
that's right.
away. I apologize. So he says he was talking to Doug Ford, and and it was an obvious photo op, and it was an obvious, staged photo op. I mean, that was pointed out very, very blatantly. So I mean, we've got that, and then we have the announcements that they're going, and then. And I hate to say this, Graydon, but I feel that, the fact that Dr. Alison Fury, who happens to be the wife of the Premier, the fact that she was going, I don't think that was an accident by any means or any stretch of the imagination. And I think anybody who looks at this situation will probably agree with me and say that, she's going, or she went, because number one, obviously she is a doctor, and yes, I'm sure she can do good work and help there, and I'm not negating that fact, and and she's a very accomplished doctor and very capable doctor and whatnot. But we cannot ignore, Graydon, the fact that she is the premier's wife, and if Dr. Allison Fury wasn't going on this trip, I really don't think this trip would have gotten the publicity that it would have gotten. And I feel that the fact that, this made national headlines, the fact that Dr. Allison Fury was on the trip, that she was going on the trip, that she was making the trip, and so on and so forth. She was, almost somewhat of a spokesperson for the trip. I don't think that, we would have heard as much about it if she wasn't there. And so I have to question the motives now, genuinely. Like, again, I think we can respect the work that these people are going to do, while still respecting questioning the motives of some of the optics here. Okay. And so I wonder, we saw so many social media posts. They really went overkill, I think, on the publicity, Graydon, that these 9 people were going to Ontario to help out, which is fine. But you've got to wonder if it wasn't more photo op and more publicity than it was, and if the work was actually just a byproduct of it. And I'm sure many liberal partisan people are going to criticize that. Many people, jumping on the bandwagon and how dare you? It's like a sacred cow, right? How dare you criticize it? But at the end of the day, I think that most people can look at this and admit that, listen, there is an element of publicity here, and it's being drawn out, and people aren't naive to that, I don't think.
Well, of course, there's no doubt that we've heard all kinds of comments, and people have questioned, and that's their right. But let me just ask this question in all fairness. If we had 9 or 10 people that were getting on a plane tomorrow to fly to Haiti or to Zimbabwe or wherever, India,
right,
to help out over there, would people be critical of that with regards to our health system? And would they have the same feeling towards that as they do now? Because, as you say, some people are saying that, it's made so much of because.
Yeah, and it's interesting that that you draw that parallel, Graydon, because of course we know what the premier's former life was with Team Broken Earth, and that was his exact mission and mandate, and that's what he's known for. To be honest with you, is with Team Broken Earth and the trips and stuff that they did and did excellent work, and for sure. So one has to wonder if this isn't almost a throwback to that. Here he is now as premier. He's at the place sending off this team, and he's there in the photos, and they're doing a big photo op, and they're standing in front of the plane, and as they're getting on the plane, he's giving them all the elbow and all that stuff, and it's all over the news, and so on and so forth. So there's a big parallel there in what he does with Team Broken Earth and what he's doing now with this as premier. With Team Broken Earth, that's great, because that's a privately funded charity, and these people are volunteering with a charity, and they're taking. So here's my question that hasn't been answered. So are these people taking paid time off? Are they taking vacation time? How are they getting paid? Are they being compensated at all by the Ontario government, or is Newfoundland paying their
Well, the
wages?
federal government is paying for the expenses of the trip.
The federal government is paying for the expenses of the trip. So is this a volunteer thing, or are these doctors and nurses still getting paid? If they are getting paid, who's paying them? Is the Newfoundland government paying them through MCP? Is the Ontario government paying them through OHIP? like what's happening here? Like we haven't been told this. Are we literally, sending these doctors and saying, hey, listen, whatever they do there, we're going to compensate them for? Like, I mean, and these are legitimate questions, I think, that we need to ask, even though it's only, people may say it's only 9 doctors and nurses, but there's only 9 healthcare workers. But at some point, I mean, like is all valid questions. I feel that
I'm
we should
sure.
be
I'm
asking.
sure, Rudy, in the days and the weeks and the months to come, that we'll get this all broken down, and somebody will come out with a bottom line, and some will come out with a report on, what effectiveness it was and all that. But
Yeah,
I guess we have to look at it and say, well, let's give it the benefit of the doubt and say all intentions are genuine and real, and let's hope that many lives are saved because of the help from Newfoundland and Labrador.
definitely. And
That's
I mean, speaking of COVID now, Graydon, just to move on. I mean, that's okay. So that's happening in Ontario, and we are sending. We did send those healthcare workers, but I mean, it was also announced today that looks like we've got some new variants here in the province. I mean, we're seeing not just the B.1.1.6 from the UK. We're
Yeah.
also seeing a South African variant. We're also seeing. I'm sorry that I don't have the official codes and stuff for these. Maybe do you or
No, just that. The article today: 83% of COVID cases in April identified as variants of concern.
right?
There's 4 new cases today, and Chief Medical Officer Dr. Janice Fitzgerald warns Newfoundland and Labrador is currently the only province in Canada without community spread, and the virus is on our doorstep, wanting to get in, of course, and certainly we've got to be wary of that now. She said most of the recent travel-related cases are variants of concern, which are becoming more prominent, and 9 were the B.1.1.7 variant, 5 were the B.1.351,
Yes.
first identified in South Africa.
Yeah.
1 was the P1 variant, first identified in Brazil, and 1 was the B.1670 variant identified in India. So I was listening to a news broadcast, CBC, the other day, Rudy, just a couple of days ago, and they talked about how the variants and it's being spread from west to east. We saw what happened in Nova Scotia yesterday, as it was a total lockdown again, and it's like Dr. Fitzgerald says, it's on our doorstep. It's waiting to come in. And Rudy, look, the thing about it is we get all people's views on this, and people have a right to share their views and whatever. But the bottom line is these variants, this COVID now, and the variants that are coming our way now are killing people. A lot more people, younger people, and we've got to do what we can to make sure we look after ourselves and the people of our province.
Yeah, and I mean, these variants are we know they're fast spreaders, and even I mean, we hear that the Indian variant, the variant that was first found in India, it's a fast spreader that's really ravaging that country right now. So I mean, we know what could potentially happen, Graydon, if that got out and we had community spread with any of these variants. So I really appreciate the measures and stuff, and I think so far so good. We're doing a good job trying to protect ourselves.
Yeah.
I just hope that we don't see another reckless act that will lead potentially to an outbreak like we saw before. So it's
and like Tammy said here on the comments here, that those 9 people that are gone to Ontario, they're gone into the den. They're gone into the middle of it. And we do hope and pray that they're kept safe and they stay healthy and protected as they reach out to help these people, for sure. But Rudy, I'm telling you now, we have to be careful. We certainly have to, be aware and be alert. We've got to do the things that we've done to stay where we are. And it's up to us.
It
to
is.
protect ourselves and others.
Yeah, we hold our own fate in our own hands here, basically.
Absolutely.
So I mean, and Dr. Fitzgerald has said it time and time again. There's a tsunami off of our shores. We see it. I mean, not just Ontario, but in Alberta, New Brunswick, and Nova Scotia now are facing some challenges. In fact, a friend of mine, a guy that you may know, Graydon,
Yeah.
is Sean Majumder, a well-known comedian and an actor, and I was chatting with him last night, and he's on his way home, trying to get to Newfoundland, but he got caught in Ontario or caught in New Brunswick, I should say,
Yeah.
because they've got some restrictions now in place that basically limits their ability, your ability to enter the province.
Yeah, and he was. Yeah, I mean, he was going to go through New Brunswick, but he was stopped at the border, sent back to Quebec.
Sent back to Quebec because basically, if you're driving through, there's no such thing as stopping. You've got to keep going, and it's just no way. So I mean, it's about a 7-hour drive across New Brunswick. So I mean, if you're going in the province and you've just left and you've been driving for a few hours, like Sean had, then you need to have that break. So I mean, you can't really stop. You've got to keep going, and there's no such thing as staying overnight or anything like that. So it's a challenge. And then I mean, he's still not even sure what's going to happen. If he drives through the province, then what's going to happen in Nova Scotia? Because apparently they've got the same restrictions in there.
Yeah.
So
I saw the interview on CBC today with Sean, and he found himself in a bit of a predicament for sure.
He found himself in a bit of a predicament, and Graydon, this brings back a bigger issue here. Basically, I mean, what does it mean for the future of your province?
Yeah, absolutely.
Sorry, right? What does it mean for the future of travel here? I've got a lot of things playing here now, Graydon. Sean made the joke. He said, I apparently how it works is when you enter the province, they take your license plate. And then they know that it takes about 7-8 hours or so for you to drive across the province.
Yeah,
so basically,
that's right.
What they say then is they watch for your license plate to leave the province. And so Sean made the joke. I don't know what they do if you don't leave, if they send drones after you or what it is. And then he also made the joke. He said, "I've never vacationed in North Korea, but I assume this is what it's like." So I mean, he's making light of it, but at the same time, it raises legitimate issues. I mean, what's the future of travel? I mean, if you are leaving Ontario or wherever, like Sean did, leaving Ontario and driving to Newfoundland, or if you leave Newfoundland and go the other way, I mean, what's it going to mean if you've got certain provinces with different restrictions and so
Well, Rudy,
on?
I heard someone say yesterday that someone who was working over in Port aux Basques said that the ferry came in yesterday or the day before, and 9 vehicles got off.
Exactly, right? So I mean, here we are now, Graydon. I mean, if we're an island at the end of the road, literally, and so I mean, if New Brunswick and Nova Scotia won't let people pass through, anyone who gets to Newfoundland has to pass through New Brunswick or Nova Scotia, right? Unless they're coming here on a tugboat. I mean, they've got to pass through to get to North Sydney. You've got to pass through Nova Scotia. And to get to Nova Scotia, you've got to pass through New Brunswick if you're coming from the west, okay? Or even if you're coming from wherever. If the U.S. border was open, you've got to pass through New Brunswick and then pass through Nova Scotia. So, I mean, what does it mean here now for travel to Newfoundland and Labrador? Leave the Atlantic bubble where it is. Even essential travel, what does it mean for like truckers and whatnot? If they if they can't stop in New Brunswick or Nova Scotia, I mean, what's that gonna mean? I'm not trying to raise alarm bells. I don't know. I'm genuinely asking the question.
Well, it's certainly a concern because, I mean, look at it, and you talk about the essential workers especially, but then, Rudy, like with all people are getting vaccination stuff, and again, they were talking about our tourism season is coming again.
Yeah.
Are we going into another tourism season where, and the bottom line is, Rudy, I'll be honest with you, if these variants are rampant in these provinces, then the only way we're going to keep ourselves safe from them is not have people travel to the island. But that brings with it a whole gamut of concerns, doesn't it?
Exactly, and that's the thing. So I mean, Graydon, I think vaccination is key here, and I mean, I'm personally getting very frustrated with Canada's lack of vaccination, and I mean, I know there's not a lot that we can do about it, but I mean, we were assured back in the early days of this COVID that the supply and was going to be there, and that Canada was prepared, and that we were a modern, developed country that we were going to get our share and stuff, and I feel that because of a number of factors, it just feels like we're not there.
Well, I mean, I guess the thing is, we're vaccinating as alongside of. I'm hoping we're vaccinating alongside of and parallel to the number of vaccines that we're being supplied with. I trust there's none that are being wasted and whatever, and that's the key. I'm so proud and fortunate. I've this is one time I've been happy I'm in the older group, Rudy. Is that I qualified to get the first dose of the vaccine.
I couldn't even make fun of you, Graydon, when you told me you were going to get the vaccine. I couldn't even make fun of you for being old because I was so jealous.
Absolutely. And I feel, I got to tell you, to be honest with you, and I know it takes time for it all to get activated and all that, but I'm feeling a certain level of calmness because of the vaccination that I've received.
Yeah, and
absolutely.
And I totally I can empathize with that for sure. I mean, I know for me, I would really love to have it right now, just because it would give you that, like you said, that peace of mind, right? But I don't know. I'm at the bottom of the barrel, as you know, Graydon. I'd say when everybody else is done, I'm going to be driving around the province trying to find one.
But I think what we're seeing in the other provinces and across Canada, Rudy, is that, and around the world for that matter, is that what we're seeing is because of the different things that's happening, the different variants and so on, I think it's causing Canada to be more aware that we need to get this done. We need to get these vaccinations done because we don't want to be caught down the road in the midst of these so many variants and not have an adequate number vaccinated.
Yeah.
So
I'm just looking here now at the. So we have received 187,880 doses of vaccine here. Right?
In Canada?
So, no, this is for Newfoundland and Labrador.
Yeah, I was going to say that's for Newfoundland and Labrador.
Right. So we've received 187,880. Out of that, 167,302 have been administered. So 157,000 people have received at least one dose.
Yeah.
So out of everybody in Newfoundland, so basically we've got 34.1% have gotten their first dose.
Mm-hmm. So Rudy, they're still saying though at the end of the summer that whoever wants it is going to have their first dose.
That's what they're saying now. I mean, that's changed since over time, as you know, Graydon. Because before, I mean, it was said that it was going to be the end of June, and now Dr. John Hagee said today that it's going to be the end of September.
Mm-hmm.
So I mean, that's that's a big jump, right? To put those numbers ahead that far. But I mean, my question here now, Graydon, is looking at these numbers. I mean, it's pretty obvious. 167,000 were administered. 187,000 have been received. So one has to wonder where those 20,000 doses went to.
Yeah,
I mean, if they were,
or if I don't know if they've outlived their shelf life, whatever, right?
Well, and that's bringing up your point again that you just made. How many of these? I mean, there's 20,000 doses that could they have been spoiled? Could they have been ruined? Could they have expired? What happened to those 20,000 doses? I'm not sure, but it's going to be interesting to see how this progresses. I mean, obviously we're reaching we're receiving our fair share, I would hope.
Yeah.
So
Yes.
so these are interesting numbers. So if you're a numbers nerd like I am, so likely exposure, source, and setting. So the number of cases. So we've had 210 cases linked to travel. 806 were locally acquired, linked to a known case or cluster. 49 cases have been community transmission or unknown source. And we've got one source now under investigation. So out of the 1,066 cases we have had here in the province, most of them have been linked to close contact with another case.
Yeah.
So
and the thing is as someone said, we got to keep the pedal to the metal. We've got to be as vigilant as we were from the start when this started with regards. And I believe, you're going to get your anti-vaxxers and your anti-COVID people and whatever. But the bottom line is, it's happening, it's real, and we've got to do whatever we can to protect ourselves, our families, our communities.
Absolutely.
So,
yeah, for sure.
yeah.
So what else is going on in the province, Graydon?
Well, Rudy, we know that a lot of people's lives have been impacted by the COVID, the pandemic, and so on. Recently in the news, I read in the news today that there's a group of workers that lost their jobs that were working at the Come By Chance refinery in the province, are now filing a lawsuit against the company for wrongful dismissal.
Wow.
Court filed documents are being filed in court. A dozen separate lawsuits have been filed against North Atlantic Refining for wrongful dismissal. And the argument is, people are saying, that, and we know it's happened. We know it happens everywhere. Is that a lot of things? COVID is being used as an excuse for companies to do things or not do things that they would normally do in normal circumstances. So I guess that's what they're saying. They're saying that they weren't let go properly. It says many of the people worked at the refinery for more than 20 years. Some people have been there since the refinery opened. They were owed pay in lieu of notice of dismissal. As such as they feel that they should have got a severance package. After that, it said they were unceremoniously laid off last March due to the pandemic. So there's a whole bunch of cases being filed. He said the hope that a new owner will be found and an operator will be found, and they could that would change if people can get rehired. That would change what people are suing the company for. It says, in the meantime, the refinery remains in a so-called warm idle thanks to more than $16 million in the way of a non-repayable grant from the province. So the workers are saying the government passed over all this money, but yet we couldn't get any severance package or couldn't be looked after. rather than lose our jobs and not have an income to look after our families.
Yeah. And I mean, Graydon, to be fair, they're not the only ones who who faced. I mean, we're not.
But they're in the news. The difference is they're in the news.
They're in the news, and I mean, there's strength in numbers. But I mean, how many people lost their job and are still unemployed? Shockingly enough, I mean, the fact is that I mean, this pandemic has changed everything. Nobody could have predicted that it was coming. We were grossly unprepared for it in so many ways. My question is, I mean, when is it all going to come out in the wash? Maybe never. Maybe, I mean, there's going to be some people who are just never going to recover from this. Not the least of the people who have lost loved ones, who have been affected by it, but because people have passed away and so on, or the people who have had COVID and could arguably have lifelong symptoms because of it. So it's all a mess to be quite frank with you. But I mean, at the end of the day, I mean, these workers, they're no doubt suffering and they have challenging times and I mean, they're still without work even here now a year later, still without work and I mean, so many companies, I mean, cried poverty after the pandemic happened and profit margins obviously in some industries plummeted. So good luck to them. I would say I would suggest that they if they have a case and they've brought it forward, then good for them. More power to them.
Absolutely, and well, you know what the old saying says: the squeaky wheel gets the grease. So
exactly right.
So it's there, yeah.
Yeah.
Rudy, we're going to switch away from COVID and stuff for a little bit now.
Yeah.
And of course, one of the big issues making news in Newfoundland and Labrador now is the announcement that the Red Indian Lake was going to be renamed. And as the Premier said, it's a step towards reconciliation. But we're getting, at the beginning, it looked okay. But now as the days go on, we're getting a lot of controversy and a lot of people talking about it's another example of lack of openness and collaboration on the part of the government. What do you think?
Well, Graydon, the thought when I heard about this, and then I heard the outrage. Well, I call it the outrage, but the opposition, I guess. When I heard the opposition to the decision, I heard Lisa Dempster on CBC already say that this is a done deal. This is what we're going with. Ted Blaze asked her point blank. He said, "Is this decision made?" And she said, "From our perspective, yes, it is."
But Rudy, it hasn't passed first reading in the House of Assembly yet, has it?
No. But I mean, we've got a majority government here now, Graydon, so they can do what they like.
Good point.
Right? So and there's some sarcastic undertones in that if you haven't picked it up. But I mean, Graydon, this is why we can't have nice things.
Yeah.
This is why as a province here now, basically we've got to reach the point where we're just at each other's throats no matter what it is, and we're just going back and forth on disagreeing. Now we can't even call what a lake is supposed to be, right? We can't come up with a proper name for a lake here. So I mean, it's one of those things, Graydon, that I just shake my head, to be honest with you. I understand that that there should have been consultation. I think there have been people especially in that area, who have strong ties to the lake. I 100% agree that it should be, the name should be changed. That's absolutely why it should be changed. But I don't know. I mean, we can't really, Graydon. We can't do this any better. Like, we can't do any better than this. I just think about the fact that the former government or the former administration under Premier Dwight Ball promised that there was going to be an apology for the rural for yes, and I mean that never ever happened, right?
Yeah.
So I mean, it's ludicrous in my mind.
Rudy, there's a familiar voice that have stepped into this issue over the last day or so.
Yes, I saw that.
The former leader of the opposition has come in, and he talks about Premier Fury presents this rewriting of history as an effort at reconciliation. He said the Beothuk have disappeared, and we have only the memory of the Beothuk people with which to reconcile. So how can reconciliation be helped by expunging their name from the body of water with which they were most connected? During the week before the ill-fated election call, I spent overnight in Nain speaking with the leaders. They are not interested, and this is an interesting statement, they are not interested in perfunctory apologies and shallow gestures. They want not a meeting of the heads, but a meeting of the hearts, and all Indigenous groups want that.
Yeah, exactly.
And I agree. I think, maybe there was the Premier, defends the decision and says there was consultation and collaboration. But again, there were stakeholders that were left out of the conversation. And we have seen that so many times. Stakeholders left out, not a part of the conversation. And they are not being asked. They are being told what's going to happen.
Yeah. Yeah, so I hope that we can reach a mediation here, Graydon. I hope that the government will, for lack of see the error of their ways here, and reconsider it. I got to show you this before we go. This is a little bit of humor to end tonight. Let's face it, Newfoundlanders were never good at naming bodies of water. So we've got Octagon Pond that looks nothing like an octagon. So
yeah. Rudy, let's end off on a couple of positive notes.
Yes,
and I think it's important that we talk about these issues because, and I think we'll probably be talking about this Red Indian Lake for a little while yet. I think that's going to be an issue. I read today that there are new gold discoveries in central Newfoundland. That's awesome. A positive.
Awesome.
And I also, if you can remember back over the last year or two, the Churchills from out east have been in the news and gone to courts and getting their voices heard about the provision for a proper service for their son who is hard of hearing.
Yeah.
And they've made it an issue, a public issue, and a lot of people have come on board. And I noticed today on the internet that the NLESD is looking for itinerates for helping blind, visually impaired, and hard of hearing students reach their full potential. That must be a day of celebration for the Churchills at a certain level.
Yeah, and I mean, they have been champions for this, Graydon, and
absolutely.
Good on them. And thank them. If they should stumble upon this, thank you for your work on behalf of so many. And it's always good. I mean, when people bring issues forward and champion those issues and don't give up on those issues.
No, absolutely.
And then it just proves here that. There is differences to be made if you keep advocating for those issues, and good on them. I'm sure they feel amazing about that today to see that change.
Absolutely,
not just for their son, but for others.
We certainly support them in their endeavors, and I've had the opportunity to have conversations with them, with their family, and it's just touching your heart as you see their compassion and. Of course, they're going to be passionate about it because it's their son, but to see their concern for children across the province of Newfoundland and Labrador is absolutely phenomenal. And as you said, we throw out to them a congratulations on what they've seen happen so far, and I'm sure even more is going to happen in the future.
Awesome. Awesome. Well, Graydon, I think we will end it there, sir. It's been a wonderful evening having another conversation. I've enjoyed it. We've covered a lot of topics, and thank you all for tuning in, whether you're watching this now live or if you're watching it later on. We find that a lot of people, don't get a chance to tune in. Obviously, I mean, it's impossible to find a time that works for everyone, but we do try to stay consistent. So if you want to plan around it or whatnot, but if not, there's no pressure. It is available as always on our Facebook page and on YouTube and Twitter and all those places. So you can always watch it after the fact. And if you do have comments, leave them below, and we'll definitely get back to you.
And Rudy, we want to say to people like Rhonda Newberry, who put on there talking about people who can't get home to see their family, let's work as hard as we can. Let's do what we can to keep it safe. Let's get as many people vaccinated as we can so that Newfoundlanders from right across the world can travel back home to this beautiful place they call home and be reunited with their families and do what they love to do.
For sure. For sure. All right, Graydon, you have yourself a wonderful night, sir.
You too, and I'm sure you and I will be talking real soon.
Yeah, and thanks to everybody for tuning in, and we'll see you soon.
Okay, take care, everybody. Have a great evening.